It's a story we first brought you yesterday. 6 children from the Kasson-Mantorville community facing the biggest challenge of their lives, cancer.
And as those cancer cases continue to pop up, the concern obviously is growing. ABC 6 News anchor Laura Lee talks with the families affected and then took their worries straight to the Department of Health looking for answers.
Those 6 cases have now caught the attention of the Minnesota Department of Health. We asked the medical experts about a possible link between the 6 cases of childhood cancer. A community concern in Kasson-Mantorville is raising eyebrows.
Everybody wants to know what is causing their child or their family member to be ill.
In less than 2 years, 6 children living in the Kasson-Mantorville area have been diagnosed with cancer. One diagnosis even took place during the course of our investigation. On Monday, we introduced you to these children who have now caught the attention of state health officials. We spoke with John Soler, senior epidemiologist at the Minnesota Department of Health.
There are more cancers in the Kasson-Mantorville area in the last few years than we'd expect.
According to the department, about 170 children in Minnesota are diagnosed with cancer every year. As for the 6 cases in Kasson and Mantorville, 4 are the same: leukemia, the other 2 a brain tumor and kidney cancer. Dr. Carla Arndt has worked at Mayo Clinic for more than 20 years and is recognized internationally for her clinical expertise in childhood cancers.
As a doctor who sees patients on a regular basis, is that normal? Does that cause for concern?
Cancer in children is a rare condition. It's certainly not the first thing you think about as a general pediatrician when a child walks into your office complaining of something. It's not uncommon for a pediatrician to go through their career and never see a child with cancer.
What is common for medical experts are the risk factors for what causes certain types of cancer.
Certainly there are genetic risk factors. In any given child, it's probably even there a combination of events. It may be a combination of their genetic makeup and their exposure to something else.
Nobody knows what causes it except for some obvious things. For example, survivors of the atomic bomb in Japan. So exposure to radiation can cause leukemia. But I would say that the vast majority of leukemia, we do not know what causes it.
The hardest part about getting an answer like we don't know why is that it just leaves open the door for any possibility. So every little thing that happens, you're always thinking, well, is this what caused it?
But when a grouping of cancer cases with similar qualifications surface, medical experts call them a cluster.
Well, the first thing to do is to see are they the same kinds of cancers, and then is to look when did they actually occur, over what time frame, where do they live, and see if it is elevated. Is it more than you'd expect? And indeed it is.
So if this cluster meets all of the qualifications needed for a medical investigation, why isn't the Minnesota Department of Health launching one?
Many studies have been done on childhood cancers, particularly childhood leukemia. And to date, the studies really have not come up with any sort of link between children.
Without doing an investigation, I don't know that one could say one way or another.
But that's not good enough for Tim Swanson or his wife Jolene, whose 7-year-old daughter is currently battling the disease.
No one can really give us any answers other than clusters do happen.
It scares me because you wonder, is it something in our system? Is it something in the grounds? Is it something environmentally?
But doctors say if there was something in the water, the ground, or the air, then why aren't adults seeing the same rate of cancer as children?
Scientific studies from really many decades have not been able to verify or indicate that these sorts of exposures are really the root cause of childhood leukemias. We don't have the scientific tools to answer the question, why did those 5 cases occur there right now? That's not for lack of looking. That doesn't mean we don't care.
And as far as their concern goes, as parents asking, why not investigate our cluster? What if we are the cluster that will give insight into childhood cancers? What does the State Department say to that?
And that is really a reasonable question. And the best way really are the large-scale studies as opposed to looking at a small grouping of people.
How many cases would it have to see before they actually investigate it?
If you're asking the question, at what point does it get to, we have never gotten to the point where it seems to be useful.
We just have to live with that, and I think that's difficult to live with because we want to know why, and there has to be a reason. There's a reason for everything.
Tomorrow, in part 3 of the Kasson Cancers, we talk to the families about how they plan to move forward, knowing they may never find out why their children have cancer. In studio, Laura Lee, ABC 6 News.